First of all, I have to take care of those who, in fact, are exposed or likely to be exposed to the virus. And that means we have to do testing. We have to get the testing kits up and ready. I would have the World Health Organization. I'd take advantage of the test kits they have available to us, even though the president says 1 million or more are coming. Let's just get all the tests we can done as quickly as we can. Secondly, I would make sure that every state in the union had at least 10 places where they had drive-through testing arrangements. I would also, at this point, deal with the need to begin to plan for the need for additional hospital beds. We have that capacity in the Department of Defense as well as with the FEMA. And they can set up 100-bed, 500-bed hospitals in tents quickly. We have to lay all that out. But we have to deal with the economic fallout quickly. And that means making sure the people who, in fact, lose their job, don't get a paycheck, can't pay their mortgage, are able to pay it and pay them now. And do it now. Small businesses be able to borrow interest-free loans. I see my time is up here. You're going to hold us tightly, I assume. But that's what I would do. Go to joebiden.com. It lays out precisely what I would do were I president today.
Well, the first thing we have got to do, whether or not I'm president, is to shut this president up right now, because he is undermining the doctors and the scientists who are trying to help the American people. It is unacceptable for him to be blabbering with unfactual information, which is confusing the general public. Second of all, what we need to do, and I'm glad that he has called a state of national emergency, what we have got to do is move aggressively to make sure that every person in this country finally understands that when they get sick with the coronavirus, that all payments will be made, that they don't have to worry about coming up with money for testing. They don't have to worry about coming up with money for treatment. This is an unprecedented moment in American history. Now, I obviously believe in Medicare for all. I will fight for that as president. But right now, in this emergency, I want every person in this country to understand that when you get sick, you go to the doctor. When you get sick, if you have the virus, that will be paid for. Do not worry about the costs right now, because we're in the middle of a national emergency. Second of all, we have to make sure that our hospitals have the ventilators that they need, have the IC units that they need. Right now, we have a lack of medical personnel, and I worry very much that if there is a peak, whether we have the capability of dealing with the hundreds of thousands of people who may be in hospitals. So we need unprecedented action right now to deal with the unprecedented crisis. And bottom line, from an economic point of view, what we have got to say to the American people, if you lose your job, you will be made whole. You're not going to lose income. If Trump can or the Fed can put $1.5 trillion into the banking system, we can protect the wages of every worker in America.
What are you doing to protect yourself?
Well, a great deal. I mean, last night we had a fireside chat, not a rally. I love doing rallies, and we bring many thousands of people out to our rallies. I enjoy it very much. We're not doing that right now. In fact, our entire staff is working from home. So on a personal level, what we're doing is I'm not shaking hands. Joe and I did not shake hands. And I am very careful about the people I am interacting with. I'm using a lot of soap and hand sanitizers to make sure that I do not get the infection. And I have to say, thank God right now I do not have any symptoms, and I feel very grateful for that.
Fortunately, I don't have any of the underlying conditions you talked about that I have to worry about, number one. Number two, thank God, for the time being, anything can happen, as my mother would say, knock on wood, that I'm in good health. Number three, I'm taking all the precautions anyone would take, whether they're 30 years old or 60 years old or 80 years old. And that is, I want to make sure that I do not shake hands any longer. I do not engage. We did the same thing. Our staff is all working from home. We are not doing rallies any longer. We're doing virtual rallies. We're doing virtual town hall meetings. We're in a situation where now I do not, as I said, when we encounter people, we're not going into crowds. And so I'm taking all the precautions everyone else should be taking. I wash my hands God knows how many times a day with hot water and soap. I carry with me, as a matter of fact, I have in my bag outside here, a hand sanitizer. I don't know how many times a day I use that. I make sure I don't touch my face, and so on. So I'm taking all the precautions we're told everybody else to take.